Well, a warm welcome to this talk, and we want to do a bit of an update on the COVID situation in Uganda at the moment. Now, I've actually got a graph here, Wefwafwa. By the way, welcome to the video. Thank you for coming. You're always very welcome.
Thank you.
Regular viewers know that you're a medical officer in Uganda. Now, here's this graphic here. And it's showing actually very low cases in Uganda, very low cases of COVID in Uganda. In fact, essentially none. Now, is this the situation you're seeing on the ground? You're not seeing any COVID locally, or are you still seeing people getting sick with COVID?
In Uganda, I'm actually working in the emergency department where we have the biggest treatment center for COVID-19 and the biggest isolation center. But as I talk, we barely receive patients of COVID-19. Even the data that I uploaded on my YouTube channel I think it was last month, it was showing that we were reporting less than 20 cases per day in the entire country, and we're having less than 5 patients admitted. So we have many different treatment centers in the country. So if we only have about 5 cases in the population of around 44 million people, so it is essentially over in Uganda. That is what I can say. It is no longer a burden. It's not something that is of public concern because everyone is living a normal life at the moment. I know you were here in Uganda and you saw this by yourself, how we moved in the villages, we moved also in towns, and we were able to travel from the capital city up to the village. At least you were able to see everything. People are no longer following the precautions, and everything is normal. It's like we've returned to the norm we were before this pandemic.
This is really good news because we were quite worried about Africa at one stage, and in 2020 we didn't know what was going to happen. So we're delighted to see that the pandemic has now basically passed in Africa. Now, if we look at this screen, Wefwafwa, we see that the people that have been vaccinated. So in the United Kingdom, we can see that the vaccinations are fairly high, probably around about 80%. In the United States, just under 70%. And we see that in Uganda, we actually know that in Uganda, it's about 27% of the population that's fully vaccinated. Do you think this low cases in Uganda means that the vaccinations in Uganda have been very, very effective?
As you can see, about only 27% of the population has been fully vaccinated. And this has taken a very long time since the pandemic started. So that means we are lagging in vaccination. But despite of that low vaccination, we've seen that numbers have gone down and people have returned to norm. Then when Omicron came in, we went and recorded the numbers that surpassed what we used to record. That is when it had just come in. And then after some short time, Omicron, when it came in, the cases went up, but then in a short time, they went low, and from that time, the cases stabilized at the low rate. So I think Omicron could have helped into the reduction of these cases. And then when you see Africa, just like you visited, you saw that many people were having respiratory tract infections. Many people were suffering from different diseases. We also believe that maybe there is a possibility of cross-immunity in Africa, something that maybe needs to be investigated. So right now, it is very normal. When you go and look into my village, you reached there, you saw a lot of people gathered on a medical camp. No one was in a mask, but after the camp, we've not reported anything, like maybe a rise in COVID-19 in this region. So you can see how everything is.
So this sounds like pretty good news, Wefwafwa. Are you happy with the medical situation in rural Uganda where you're working now?
No. I'm not happy with the medical situation here. The situation is actually very bad. We lose a lot of people due to things that could require some simple interventions. And here we see that they're putting into efforts into things that may not help to ease life as per now. A lot of people are struggling, a lot of people are dying of common conditions like malaria. Recently we just lost a child due to malaria who was very young, about 3 years old. Died from the house because the father didn't have knowledge about malaria, because the father was poor and would not be able to take that child to the hospital to be able to pay for diagnostics and treatment. So our problems are actually very small. They need some few interventions, not vaccines right now. People are dying due to malaria. We need antimalarials. We need the lab equipment like just microscopes to be able to look at those parasites that cause malaria and to be able to grade the severity of that malaria, and we'll be able to treat those people. So we also need antibiotics. People are dying due to bacterial infections. People are dying due to parasitic infections. So we need other drugs like ivermectins, albendazole, mebendazole, and others. We also need just to go into communities and teach people about these conditions. That is what we need. People don't have actually knowledge about the dangers of malaria, though it has been there for a very long time. We have to keep reminding them every day. People need mosquito nets. Treated mosquito nets. So all those things, there are small interventions that we must put first, because those are our greater needs right now.
Have you actually seen people suffering and dying through conditions that could have been easily treated if the medical facilities were there?
Yes, I've seen very many people losing lives, children, pregnant mothers. It's very sad, but I've seen them. A pregnant mother dying due to severe malaria. I have seen children under the age of 5, adults. I have seen people who come with the stroke because they didn't get a chance of measuring their blood pressure, because they will need money to go and measure their blood pressure. I've seen people who die of complications from diabetes mellitus. A lot of people lose sight. These are things that we can prevent if we taught people about the balance diet. If we gave them those screening tools like blood pressure machines, the glucometers, and taught them how to use. So I think these are the things that we need at the moment. Those are the problems that are killing people every day. In my village, personally, I've never seen anyone who has ever died of COVID-19. Since the pandemic started up to today, we are a population of over 10,000, but I've never seen anyone dying of COVID-19. But I've seen children dying of malaria, I've seen pregnant mothers, I've seen people dying when they have stroke. So those are the things that we are seeing daily, and are things that I think we should prioritize.
I've been with people many times when they've died, but usually in England we've done everything that was possible. But yes, you've been with people many times when they've died, and there's treatments that could have been given.
Yeah.
And you and me are actually both grieving at the moment. There was a boy at the medical camp that you and me were at last month. And I saw him straight away with a big swollen tummy, and I said, go and treat that boy for worms. And we could treat his worms. That was okay. But then you've told me that he died the week later or 2 weeks later from untreated malaria.
He died. It was too hard to take that the boy died. We don't know what he could have done maybe in the future to change the community. He died. There are some people who just die when you know what to do, like personally I'm in position of doing many things, but because you don't have resources, you don't have those equipment, you want to help, but there is you're limited, your hands are tied. So it is sad and it is really bad, most especially when you are there. Me, have been in emergency. There are people who come when they are totally poor, and someone dies when you are looking. It is so painful. It's so painful. So I think if I had the chance to be in position of making decisions, the $1 million that are being invested in vaccines and those other things, that I think, based on the data that we don't need, maybe they will just be given $1 million and it will be able to solve maybe the problems that could have led to the death of over 1 million people in the whole country. So this is a serious issue, and I think people who make decisions should think about it and start, seeing things from ground. I agree with the WHO, with the Minister of Health and all officials with what they are doing is really good, and we appreciate. But we are the people on the ground, and we know what we suffer from, and we know what we need more. We just have to, I'm just being honest with whoever is watching. That is what we need. Actually, those are the things that I mentioned. Those are the things that we need. At the moment, I don't need it, and I believe I'm not very different from other people I'm living with. Their problem is not a vaccine.
So this boy that died of malaria last week, if you'd have been there and you had the right medications with you, you could have saved his life. Yeah,
I could have saved his life if we had equipment for testing, and if we had free medication for the boy would be alive by now. But now he's gone just because of malaria. He didn't go due to COVID, but malaria took him. That is one boy that we've known. But there are very many boys who are like that boy in that very community that I was not able to get into contact with because they didn't come on the medical camp. But he is one of them who are dying. So the situation is not good.
I think we should say this medical camp we did with Wefwafwa, you and me, last month that you organised, I think the camp probably cost about $3,000 or $4,000 altogether, and we treated 1,000 people.
Yes, we treated over 2,000 people on that day.
Yeah. So we're looking at about $2 per treatment. If we could afford a medical camp every week, that would be great, wouldn't it?
That would have been life-changing, even if it would just be there like once in a month. Because on that camp, we were able to diagnose, we were able to give medication, we were able to teach. So people really benefited. If we were just able to get that money to be able to have at least a camp every month.
But right now, with very limited resources, you are treating people with these infections. You are preventing these diseases. So
yes,
what you're doing now for the individuals is everything better than nothing.
Yes. Yeah, we are doing whatever we can within the budget that we are having. That's why we are never resting. At least we do something. Even if we don't have any money, we can move to the villages, even if it's on foot, go and at least teach people. We know by doing that simple intervention is doing something. So we are trying to work with whatever we have to make sure that we meet the needs of all people with different financial backgrounds, with different academic backgrounds. I mean, just from any background. We just want to make sure that this whole thing is leveled when it comes to health. We want the ground to be leveled for every person, no segregation, whether poor or rich, with which color. We want everyone to have equal rights, and that's why we are always reaching to everyone to make sure that at least they have what we have.
Not only that, we're planting thousands of fruit trees, and this, to me, this is probably the most important thing, you're working with the Ministry of Health in Uganda, and we aim to replicate this model that we've used here that's been so effective around the whole country. And hopefully around about all of Africa. We have a model that works using very limited amounts of money, but targeting it directly, targeting these sources directly through local clinicians like yourself. We know it's working locally, and we believe it can work on a much broader scale as well. That is the ambition that you and I are working for. And many others.
It can actually work very well. If they just got this idea and we just expanded and spread that gospel throughout this whole country, I believe it will change and it will extend even up to East Africa. I was in a meeting, I think, about a month ago, and I was able to interact with some professionals from Nairobi, that is Kenya, and then some came from Tanzania. And when I told them about the model, they were so excited and wishing that we can extend this whole thing in East Africa. So if we go into East Africa, I believe we can go to the whole continent as well.
Absolutely, and that's what we're working for. Wefwafwa, as always, thank you very much. I know you're a busy man, and thank you for coming on the programme.
You're welcome. Thank you.